All right, we're back on.
Good?
Good.
All right. We can do this.
I know. I know.
That's awesome.
Yeah. No. Again, thank you so much.
Absolutely.
I know you're like super busy, and you are. There isn't anybody else that is as well versed as
Oh, you're so
yourself
sweet.
to talk about this topic. So, since we talked about getting together and like answering all these questions, I've been
Yeah.
asking my audience, and I've been asking, and by the way, let me introduce yourself first. I forgot. uh, Carrie Pagliano. She has been a physical therapist, women's health physical therapist for over 20 years.
Yes. Makes me
And
feel old.
oh, that no, you're not old.
Sure.
And if you want to add anything else to this introduction, please introduce yourself and tell us.
Well, when I introduce myself, the first thing I say is I am a mom and a wife. So I have two kids. One is 7.5 and the other is 5. And I think I learned more from them than I ever learned in school about, pelvic
Everything.
health and everything. Yeah, all the things.
Yeah, I know.
So that I think also gives me a little bit of street cred too, as far as kind of understanding where moms come from. But my background is, I've been practicing for nearly 20 years.
All right.
And, I've been a runner since high school, country ski. Yoga. I started CrossFit about 2 years ago, and kind of have had all the issues too. I had diastasis after my second. I had some continence issues after my second. I had hip surgery 12 years ago, and I had some back issues. And so a lot of what I teach moms and when I work with moms is, it comes from my background, but it also comes from kind of working through this stuff myself and understanding what it's like to not know what to do and be scared you don't want to do anything wrong.
Yeah.
And to try and find that pathway on your own. So,
and I think that also, just to add to what you're saying, because there is so much conflicting information out there.
Absolutely.
Like you have two extremes, I think, of information. You have the very conservative, like you have these issues, you're supposed to do nothing, be nothing, and just stay there.
Yes.
And you have the other spectrum of the like the whole thing that is like, oh, that's fine, just like go. And so like where is the happy medium of it all, and where does the safety lie?
Exactly. And I think, I always tell people that come in to talk to me, I understand why you're confused because, social media, everything's all over the place, just like what you said, but the research is, it's not that deep. It's not like, it has the funds behind it, like low back pain and, opioid abuse and those sorts of things. So it's confusing from a research perspective, but also for the public.
Yeah. And with that being said, I think there is a lot of also misinformation, and I'm going to start going through the questions here.
Yeah, absolutely.
I think they really fit where we are in the conversation right now. So I think that the first question is, what is diastasis recti first? Sure. And what are the symptoms of it?
Sure.
And obviously what causes it. So let's put it all together, because I think one to the other one.
Yeah, the cause, I think they're still trying to figure that out. Obviously, it's most common in women who have had kids. And I think now it's kind of like the new thing. Everybody thinks they have it. I give workshops quarterly at a local yoga and Pilates studio, and you get 40 women that come in and they all think they have it, and maybe it's like 2 that do. Essentially, it's an abdominal separation, and we all have it. It's very normal. Okay. And it expands during pregnancy because obviously the uterus is growing. And some of the reason why that gap may remain may be genetic. It may be based on, the collagen that mom and dad gave you. It may be based on how your movement strategies, how you control pressure, things like that. But as far as kind of how to measure it and how to treat it, the first thing is to understand that it's not just the gap, so that space between your 6-pack abs in the front,
Okay.
And if you think about like the hottest guy, best abs you've ever seen, they've even got a little one. So
Yeah.
it's normal. It's normal. But I think when it gets women's attention is when it's an aesthetic issue. And so not only are we looking at that gap, but we're also looking at the depth of it. So lots of women, when they're doing crunches or planks or things like that, they see sometimes a bulge, or they see almost like a canal there.
Yeah.
Those can be indicators, if you look at it, that that there might be some issues as far as controlling the pressure, whether not well enough or not. As far as symptoms go, it's one of those things. Diastasis really isn't. You don't typically get symptoms, and actually in the literature, there's not a correlation between diastasis and low back pain. Or incontinence. And some people have tried to make that connection, but in some of the literature, there's no direct connection. However, those things are commonly found in the same population, which is postpartum.
Okay, but here's the thing, because when I heard the conversation, you said that there is very little literature. So although we go by what the literature says, at the same time, almost like the streetwise kind of stuff might be a bit more relevant than they study at the moment, because of the lack of information or of depth into the researches out there.
There's better studies the last, I would say 2 or 3 years or so. But again, I think you can find continence issues and low back pain and diastasis in a pretty similar population. So whether one causes the other, I don't know that it matters to people. I think they just know that, they're postpartum. That's a problem that they're having. They just want to get rid of it. Yeah.
Okay. And so like the low, because that's one thing from working with moms and stuff like that. I see the repetition of the low back pain coming pretty often. And at the same time, and just to go back here real quick, you said about the depth of the hole.
Exactly.
And as well as the width. And one thing I see very often is women coming up to me, they're like, I'm freaking out. I just had a baby, and my gap is like a finger and a half wide, and I want to close it all before I get pregnant again. And they're like legit having meltdowns over it.
Absolutely.
My question would be, is 1.5 wouldn't be considered technically a medical diastasis recti? Is that correct? With the measurement data, yes, you're correct. And the measurement data is even inconsistent, because anecdotally, we're all, measuring it with our fingers, but I'm pretty sure you and I have different, finger width and that sort of thing. And that's what they've looked at. But now there was a study, I think it was about 2.5 years ago now, that was starting to look at that depth piece of it. Okay. And getting the linea alba, which is the connective tissue between the rectus abs, getting that to be tensioned when you're activating the deep abdominals, which is the transverse abdominals. So for your audience, there's about 3 layers of your abdominals. You've got the deep ones, the transverse abdominals. Those are the ones that are closest to your guts. Then you've got the diagonal ones, the internal and external obliques. And then on top of that, to the center, you have the rectus. And they're the ones that are the most on the outside. Then those are the ones that we tend to see that are probably most important aesthetically. Okay. So what they looked at in this particular study is if you turn on the transversus first, which, and there's a lot of good studies to say that that's how we move, prior to pregnancy and without issues. What that actually does is open the gap slightly, which totally freaks women out. But we're talking millimeters here, like barely anything. And so what that would do is take the fascia, which might be kind of wrinkled, tension it, and then instead of that depth being very much like a canal, it ends up being like a very, very shallow, and that's what we're looking at. Yeah. And I think, the big thing that everybody's worried about now is the whole doming thing. If I see doming when I'm doing sit-ups, if I see doming when I'm doing, toes to bar or, any sort of movement, what does that mean? And we're still trying to figure that out. It means, potentially that you're not controlling the pressure in your belly as well.
But that's probably only an issue if you have organs coming out of your body, which would be a hernia. So as far as that being bad, it's bad when organs come out. And we kind of talked about this, I think it was in September, October when we met. If you have organs or liquids flying out of your body, that is a good indicator that what is happening is not good.
Yeah. And,
so that's a good indicator.
Now that we're talking about this, I have, what exactly is the intra-abdominal pressure?
Sure. So,
or IAP as.
Yeah. So you kind of have the abdominal cavity, which is the diaphragm, which sits right below your lungs. That's the muscle that you breathe with. And then the cavity that kind of comes down to your pelvic floor. And there's normal pressure that's there that kind of maintains your organs and so on. And so if you have pressure that's maintained well, that means you have good kind of movement strategies of your back muscles, your abdominals, your diaphragm, your pelvic floor, that sort of thing. If you have increase in pressure, such as coughing, sneezing, bending, lifting, jumping, anything that might change that downward pressure, holding your breath is also another one of those. Ideally, you're going to rely on all the components of that system to maintain that pressure. But if there's a deficit somewhere, maybe it's pelvic floor, maybe it's abs, maybe it's back, then you might become symptomatic if that pressure isn't controlled well. And the symptoms usually could be, pelvic floor symptoms, which would be heaviness because of pelvic organ prolapse, any sort of continence issues. And as far as the abs are concerned,
basically when you pee yourself. Like, let's talk the language.
Exactly.
Like, it's whenever you pee yourself, whenever you're doing
exactly.
Which can be very embarrassing for a lot of women.
Oh, absolutely. Absolutely.
Okay. And that's good that you talked about this. So where do the crunches come as the bad guy when it comes to diastasis and pelvic floor issues? So because every material that you read when it comes to pregnancy and post-pregnancy is like, crunches are the devil. What is it that makes them the devil?
Well, and that's where I think there's been a lot of changing of minds in the last couple of years. I was basically trained that way. And I've kind of, and I think this is through my pregnancy experiencing too, like, well, why? And we just took it for what it was before. And now that we've kind of started to look into it a little bit more, crunches while you're pregnant, let's just be honest. If you have a growing fetus, doing a crunch is really hard because that fetus is in your way. But let's be honest what a crunch actually is. It's your, as recently as last night, my 5-year-old screaming in the middle of the night with a nightmare. I got to get up quick. I'm not going to gently roll to the side and sit up and get out of bed. I'm going to do a crunch to get out of bed to get to my daughter as fast as I can.
Okay.
So this whole idea of, don't do crunches. Well, if I do what I just did last night, that's a crunch. So I need to train to be able to do that. And so this whole idea of crunches are bad, I think is oversimplifying it. For better or worse, it depends on who we're talking about. If I have a person in front of me that they're doing a sit-up and holding their breath and they have an umbilical hernia, we might work on scaling that a little bit. But if you can, let that breath go, exhale on exertion coming up, control the pressure well, and you're not getting any symptoms, do the crunch.
So, just to interrupt you here real quick.
Absolutely.
Just because I'm more aware kind of like of what the audience understands.
Absolutely.
So basically what you're saying is that the problem is not the crunch itself, it's how it is performed. And because most people are more likely to not do the crunch by controlling the pressure in a correct way, then people just say it's bad, just because it is very challenging to make people breathe correctly through the movement.
Yes. And I think it's also easier to say, just don't do this whole bunch of things than actually find the strategy that works for somebody to be able to perform an exercise. I hate telling somebody, don't do this ever. I don't think anybody likes to hear that. So if we can give people, an idea of, hey, this is how you're performing it, we can do this a little bit better to control the pressure better, to make your symptoms less likely. Let's do it.
But would it, like, for example, I understand that the problem is not the crunch itself, but whenever we're talking about pregnancy and like 6 weeks postnatal, would crunch be like, oh yeah, we have to do crunch, or is more like a matter of taste? Would it be the best exercise for that specific moment, or we can give that patient or client or athlete a better route or a better option of exercise that is going to be easier for them to control the intra-abdominal pressure when they're exercising?
Yeah, absolutely.
So it's like here what we're talking is like, it's not doomed, it's not the worst choice, but it is not the best. It wouldn't be the top of the priority list.
Would you start with that, 4 weeks postpartum? Probably not. But I've also seen the opposite. I've seen women so scared to do anything. They're sitting there 6-8 months out and are so weak because they're scared they're going to screw something up. They've been told that crunches are bad, don't do it. And then they're so weak. And the second you give them permission, say, no, this is actually all right, they start to feel like themselves again. And so I think that's the part that maybe inadvertently came from a period of time that everybody was super conservative. In that process of saying, don't do this, you might hurt something, we actually really scared a whole bunch of people. So, but to your point, would I start with a crunch? Depends on the person in front of me, but is there a time and a place that, I would say to somebody, don't do crunches at all, only if, kind of like what we said before, if there's organs flying out of your body or you're symptomatic or things like that. So, but if you don't like doing crunches, you don't have to do them either. I mean, there's plenty of things to do. There's lots of options.
Okay, no, cool. Thank you. And with that being said, we're kind of leading here a little bit on towards the postnatal and stuff like that. What are your thoughts on binders? I get these questions. So
it's geographic. It's funny. There's certain areas of the country, certain areas of the world that are very, very hyper-focused on it. I will tell you, the literature is mixed. But what I will tell you anecdotally, myself, I did not use one after my first. I did after my second. And I had ended up with 2 C-section. The first was unplanned. And for me, for a very, very short period of time, I would say just a couple of weeks, it was helpful for me to have one. And I used a high-waisted, it was actually a lymphedema garment. It was a high-waisted lymphedema garment that went from...
kind of stuff?
It was a little heavier than Spanx, but it literally went down to my knees and then up to my diaphragm. And it gave my brain a better sense of where my body was in space. And because I was, I'm not a gigantic person, but I got up to 200 pounds with my second child, and they were big babies. And so when those abs are going back, they had no idea where they were. So I think short-term use, so a couple of weeks in the very beginning, but anything beyond, 4 to 6 weeks, I don't really see that there's a benefit. You start to kind of rely on that a little bit too much. Okay,
but for you're saying in the first four weeks, is it because it is going to improve the diastasis, or is more from all right, I just want to feel like, because I know exactly what you're saying. I saw that my bits were like falling everywhere. So wearing something like, it was just like an underwear that kept me a bit tighter and like kept everything there, making me feel like I was going to collapse. But I like from a medical standpoint, is it going to bind the muscles back?
No, I will tell you, back in the day, and this was probably 10, 15 years ago, and I still see therapists doing it now, which is kind of frustrating. We used to literally put a band around our belly and pull the sides together and say, okay, well, if you just train the abs there, then they're going to learn how to work there. Well, there's no science to actually back that up. And this is the really hard part too, is we still don't have a good reason why you may have a diastasis and I might not, or vice versa. And I mean, this is a health practitioner that I was well aware of this going in. I was well trained, didn't have it with my first, had it with my second. And some of that, is biology. How much of that is pressure and use and so on. But we still don't have a good reason why certain people have it, nor do we have the ability to say 100% that we can do things to prevent it. And I think that's the hardest part, is we, as pregnant moms, we want to do as much as we can and do the right thing, and postpartum too. And I think this is the hardest part, is you can do everything right. And sometimes there's a little biology that may work against you. And sometimes biology may work for you. And I think understanding where you can have control, and where you might have to be aware that you can't necessarily control everything, which is, I think, rule number one of mothering. I don't know.
Yeah. And what, speaking of that for me personally was one of the most challenging things of mothering, coming from a competitive background.
Yeah.
That I have always had control of everything within my body. Like, yes. I knew, sometimes I knew if I had put on a pound.
Yeah.
It was insane. And then next thing I know, I have zero control over my body. I'm like, what's going on?
It's hard. And I mean, for me, I had both my kids. I think I had my oldest when I was 33, 34, my youngest 35. You control pretty much everything in your life up until that point. And again, trying to fit exercise in and do what you need to do for yourself physically, but also need to do what you need to do for yourself mentally and for your kids is probably a pretty challenging thing too. And nobody wants to get it wrong. But at the same time, we're all still learning on this.
Okay. So with that being said, you said that we don't know exactly the cause of it and
right.
telling women what to do, what not to do. So we know that the increase of pressure in the abdominal cavity can be one of the causes. So avoiding exercises that can potentially increase the pressure, wouldn't it be a preventative measure to be taken whenever dealing with antenatal, a prenatal, a pregnant woman, and a recently postnatal client?
Yeah. What I can tell you, and this is what I tell my patients too, I can tell you what's in the literature, and then I can tell you kind of anecdotally sorts of things. So literature, they've actually looked at women who worked out and did a lot of, high pressure things like CrossFit, and women who didn't, and they're still not exactly sure kind of if you can do anything to prevent it. Anecdotally, what I can tell you is, when I work with women who are pregnant, who do heavy lifting, who do more dynamic kind of HIIT training sorts of things, we're looking at how we can continue to participate in those activities. How can we scale it down, and what their corresponding symptoms are. So lots of times you have women who come hell or high water, they're going to run through their entire pregnancy. They're going to, do the last WOD, on the day they deliver. I think it's just being mindful of what your body is feeling. And there's no prize at the end for getting through all this stuff. But if you're symptomatic, if you're feeling things coming out of your body, if you're feeling pressures that aren't great, and you use your body as an indicator whether to stop or not. The other thing is being aware of heart rate and kind of all that other stuff.
Yeah, and I think it is very valid that you say that, because I know that for a very long time things have been very conservative.
Yeah.
At the same time, I almost feel that for some time you went the other end of the spectrum.
I agree.
And you have women doing all this kind of crazy stuff, which I know that I understand that it isn't my place to tell anybody what they should and shouldn't be doing during pregnancy. Yeah. But with that on the as a professional who trains and deals with pregnant women and postnatal women, I almost feel like it almost became a free for all, and then women start to feel like they were disabled almost, because I can't do that. No, I should be keeping up with my workouts and doing and all this kind of crazy stuff.
Yeah.
Isn't about being able to do it, but do you really have to be doing that? Like, is an option that will make you feel
Absolutely. And I mean, if you go to the guidelines from the American College of Obstetricians and Gynecologists, I mean, they have gentle walking and those sorts of things, but
yeah,
let's be honest, that doesn't work for everybody.
no, I'll do it myself.
But at the same time, I think the pendulum is shifting a little bit. I see a lot more voices on social media now about women who really thought that, you know, they could do everything right up until the end. And now they're having a second kid and actually doing things very differently the second time around because they had some, or maybe even went back to workouts too fast after delivery. And I mean, myself, I ran probably up until 18 or 19 weeks with my first, and then literally got to the point where it was just uncomfortable. And then with my second, because I had a first, I don't even know that I ran that much, and it just wasn't comfy anyway. So I don't know if you gain permission to be more realistic the second time around. But the first time around, you know, do things that you love to do, but at the same time, if you don't feel comfortable, like if you have discomfort, stop. If you notice that you have you know, a harder time catching your breath, it's okay to dial it back. These are all things, but at the same time, you're not dead, you're pregnant. Like, you know, the casual walking, that didn't work for me.
Yeah,
you know?
no. I would go batshit crazy if I.
I hear you. It's mental sanity.
Yeah, like for me, but the training and exercise was an outlet, and I do understand that it is a matter of listening to our body. And I would like to assume that a lot of people have body awareness enough to know when they are going too far or too little, but
not always
as much. That is not the case. So I think that I love the idea of telling somebody, listen to your body, but at the same time, there are people who take 2 steps and they'll be like, oh, I'm tired, that's it, I'm done. And you have the people who will be doing like jumping out of a parachute at
exactly.
Like, oh no, I'm great, I'm fine. I'm gonna go skiing, hit these slopes. So I think that the whole listening to your body, it's great, but at the same time,
well, and that's when, you know, you need to go back to, you know, ultimately what's important is the health of the fetus.
Yes.
And so, you know, knowing what, you know, your baseline measurements are, what's your baseline heart rate, what's your baseline blood pressure, because those are the things that are really easy to check that can give you a sense of whether your exertion is too much or not. As far as impact is concerned, you know, worried about high impact activities, whether that's jumping or, you know, running or things like that. If you have pressure that continues on past the activity, or if you have pain around the pubic bone, or, you know, you're going to the bathroom every 5 minutes, those are signs that it's time to dial back. That's not to say, you know, you can't do, instead of doing a 40-minute run, what if you did, you know, a couple minutes run, a couple minutes walk, those sorts of things. That still gives you the endorphins and that chemical rush that you're looking for. But I think the hardest thing that people have a time with is being able to scale yourself. And they think, oh, well, if I can't run, I can't do anything. And then, you know, their physician just tells them to swim. And let's be honest, swimming's a pain in the butt and some people hate it. And getting to a bathing suit when you're pregnant, that's just like,
if
it's not going to happen.
I'll be like, no, it's just not, no.
So I think, you know, if you have a trainer that you're working with that's willing, or, you know, even a you know, a PT or a health professional that you're working with that jives with you and gets that, you know, casual walking.
A physical therapist, because in Europe, PT is personal trainer.
Yep. Oh, got you. Oh, yeah, right. I forgot who I was talking to.
No, I have
physiotherapist, wherever you're from.
We have. I have a lot of followers in Europe based. So
yes, physio. I am a physio. Yeah.
So So let's say I have a postnatal client, okay, and she wants to do jumps, or she wants to go back to running.
Yeah.
And she has some leakage as she gets to, let's say she wants to run a half a marathon, and she gets the 5K or 8K line, and that's when her pelvic floor starts to go.
Right.
she starts to have leakage. What would be your suggestion for somebody like this?
Sure. So, I mean, I would be amiss to say that it's so important to get screened beyond what your OBGYN does for your clearance exam. They're basically putting a speculum in, making sure all the parts are there, and that's kind of it. So as far as getting a muscle assessment by a physiotherapist or a physical therapist, we're going to have a much better idea of, are your muscles turning off and on at the right time? How strong are they? Are they coordinated? Can they control the pressure? Those sorts of things. And with leakage, and this is something that people don't necessarily realize, especially leakage with activity, which is stress incontinence, that can be because of muscles that are either too weak or muscles that are overactive. And so what I mean by that is, if you have a muscle that's overactive and it's already on like this, and you ask it to turn on more, like to counter increased pressure with impact, it doesn't have any more to give. And so when I have patients that come in and they say, oh, I did Kegels and it didn't work, I'm like, great, we've ruled that out. 9 times out of 10, it's because those muscles have to be taught to relax first, because they're already up here. They need to be taught to relax, and now they have some ability to turn on to counteract that pressure. And so I think, people think, oh, well, I did my Kegels, it's not working, I need surgery, or I can't run anymore. And that's just not the case. So the important thing first is we've got to figure out why it's going on. But the other thing I tell people too is, I had a friend who I used to work out with, she contacted me the other day and having some issues with her jumps. And find out where your threshold is. So for her, for example, she could do 30 to 40 double unders without having leakage, but beyond that, she couldn't. And, it's kind of like, how can you take something and break it down and add rest? Well, if we do, 25, she rests for a little bit, can she actually get 25 or 30 more, which is actually more than she got before? That tells us a little bit that it might be an endurance issue. So I think understanding what the actual parameters are for the problem. So for runners, is it only when you run downhill? Is it when you run uphill? When you run, do you run with your chest high and hold your breath? There can be so many different reasons for leakage, but understanding a little bit more about your symptoms, are there patterns to it that you could tell your health practitioner about, that they can start to piece this together and figure out what the best strategy is for your particular problem. So as much as I would love to say that, every leakage with running is for the same reason, it's not. Pressure can have something to do with it, but it's everybody's got a little bit different solution to it.
No, thank you very much. And
Sure.
I do appreciate what you do. And I do think that it is important for women to see physical therapists, but it isn't the reality in a lot of places in the world.
Well, it's not the culture. It's not the culture.
Not even the culture. Some people don't even have don't even have the professional, the workforce for that, especially in European countries. As I said, I've lived there myself, and I've had a lot of people there because of the setup of the health system. Looking to train professionals to be so specific, like women's health professional. It's almost as horrible. It's a bit misogynist. It's a society that, like, a woman peeing herself is not, it shouldn't be, it isn't as a priority. And these are the women that I'm trying to provide with information. Because it's not because they don't want to see a physical therapist, it's because they don't have anybody to see.
Well, and that's where, I actually have an interesting kind of perspective on this. So I currently serve as president for the Women's Health section for the American Physical Therapy Association. And we're part of the International Association of Physical Therapists in Women's Health. So I've actually had some good interaction with some of our foreign colleagues. And it's so interesting culture-wise, where you have some countries where postpartum health is so much the norm, and there's care right away. And then there's other countries where it's just not the case, and very much speaks to what you're saying. So, I mean, I think that, if you don't know that there's access in your area, definitely find it. But if there isn't access in your area, it's one of those things to be able to self-diagnose. We're going to be able to hit, just a certain percentage, but it's not going to always be everybody. So, I mean, I think if you're trying to figure it out for yourself, the first thing is to figure out, is it something that if the kind of the list that I start with people is, let's start with pressure. Are you breathing? Do you hold your breath? We know that breath holding increases pressure. So when you run or when you jump, are you breathing? Do you exhale when you exert yourself? So if you think about heavy lifters and they grunt when they get stuff over their heads or whatnot, and in some lifting forms, you have to hold your breath to deadlift, really high weight or something like that. So looking at breathing strategy is something that you can do as far as being aware of your own breath holding. Mm-hmm. I think another thing can be, can I find my muscles? And lots of us didn't know what those muscles did before we had babies, and I didn't even know I had them. Well, exactly. And no one looks, and, being a mom of a small girl, my 5-year-old very much knows the difference between her urethra and her vulva. And so, yeah. Her poor teachers. But it's one of those things that, it's important to understand what that part of our body looks like and how it functioned, so that when we do have things that change with it, could I contract before? And that's what I run into a lot with patients is, if you had a prior history of having difficulty starting your urine flow or pain with sex or back pain or leakage, those can be potential indicators that you might have an issue after. It's not definite, but if you have difficulty starting your urine flow, then probably those muscles have difficulty relaxing. Or if you had pain with intercourse, that could be difficulty, those muscles relaxing. So that kind of overactivity we were talking about before, then you would want to definitely focus on some low belly breathing or some relaxation exercises or those sorts of things to kind of get those muscles to relax a little bit. So I think, even just squeezing around your finger, putting your finger in the vaginal opening, squeezing around and you should feel, instead of just a closure, you should feel a closure and a lift. Okay. So that bladder's supported. And you should feel it all the way around, not just the front or the back. It should be kind of everywhere.
And you spoke there about heavy weight. What so from what I understand what you're saying, a lot of people are like, oh, I'm scared of lifting heavy weights because I have either a pelvic floor dysfunction or a prolapse. We haven't talked about prolapse, but and diastasis recti. And I'm scared of lifting weights. So would it be correct, and please elaborate on that if sure. The problem isn't necessarily the weight itself; it's the way is being lifted and how it's being distributed. So it's a matter of how you breathe throughout the movement, opposed to just don't lift heavy weights.
Exactly. And I think that goes along with a permission to, if you have good technique and good breath strategies and good movement strategies, yes, you can do some of these things. So it goes back to, if you lifted before, go back and build your baseline again. Go back to, focusing on your technique again. Yeah. When you lift, ideally we want to exhale before and during exertion. Again, if you're a high level lifter, there's other things that apply, but I think for the bulk of your audience, ideally, making sure you're exhaling before and during the movement, that's going to engage. We've got real-time ultrasound imaging that shows that the pelvic floor engages, the deep abdominals engage, you get that deep underlying support so that if you are having pressure control issues, this is going to give you a way to kind of shore that up a little bit.
And also another thing that it's funny that we saw on Anthony's, that's where we met Anthony. Yeah. It's almost like I feel like people are a bit obsessed with form, and that's a mistake that I had before as well, on being, oh my God, this is the only way to perform an exercise. Yeah. And ultimately, the form depends from person to person, and what is best is what makes them perform their best.
Yeah, it's exactly, if you look at, runners are a great example of this. So if you look at some of the most amazing Kenyan marathoners in the world, you look at their running form and you think, how can you possibly go that fast? And, the fact of the matter is humans are resilient. We're meant to do things in different ways. It's just how our biology and our strategies kind of come together to do that. So you do as close to, good form as you can get. You control the pressure as much as you can. And that ultimately, best case scenario is going to give you the best way to perform that exercise for you. And ideally with the least amount of symptoms and so on. But that may mean that in the beginning, you may spend a little bit more time with lighter weight and working on getting your depth in your squat, or, working on, your range of motion and those sorts of things, and finding those muscles again, especially postpartum, and just going a little bit slower and not necessarily worrying about adding so much weight right off the bat and jumping right back to where you were.
Preach. I have two more questions because I know you have to go.
Yeah.
The first one is I have some clients that are going to go through the surgery, the abdominoplasty.
Yes. Mm-hmm.
To bring everybody together, which is the to correct the diastasis recti.
Yes. Mm-hmm.
Is there any kind and one of the main questions that keeps on popping up is that they're freaked out that do anything after the surgery, even years, that it's going to bring them back to where they started. So could elaborate a little bit on that.
Sure. So, I mean, it's kind of like any major abdominal surgery, and I'm going to throw in there, cesarean section is a major abdominal surgery, hernia repair, major abdominal surgery. For soft tissue healing, 75% of soft tissue healing is complete by about 6 weeks. So usually that's when you get your clearance and so on. So usually by that point, things aren't going to fly open or pull apart for the most part. It's not until about 12 weeks that you've got full soft tissue healing. But I mean, the thing is, we use our abdominals every day to get up and move and so on. So those abdominals are working within, a couple hours of getting up and moving around anyway. Mm-hmm. So I think the most important thing, and I would say this about people who have surgeries to correct pelvic organ prolapse and stress incontinence as well, is make sure you understand how your movement potentially influenced how you got there in the first place. And by that, I mean, I've seen plenty of patients go through surgery that did a lot of breath holding or bearing down when they had bowel movements or things like that, didn't correct that, and then ended up with revisions later on. So it's just as important, even though you got the surgery to correct it, you also have to make sure that you now move in ways that
not going to cause it again.
Exactly. Okay. So, and because the abdominoplasty tends to be categorized more as cosmetic as opposed to something that's functional or whatnot, it's still just as important post-surgically to get somebody to look at that and make sure that you're turning in those deep muscles and getting them working again, because they do shut down. I mean, it's kind of a big surgery. So if you do have the option to see, a physio nearby, definitely take that up. Yeah. But it's you can return back to all of that stuff. But again, you've got to build that foundation, making sure to look at your breathing, sure to look at your pressure control, those sorts of things, so that you don't end up in the same problem that you had before.
I'm going to add up a quick question here.
Sure.
Is there a difference on the effect that the type of delivery is going to have on the pelvic floor and diastasis recti? So, for example, a lot of people who have a cesarean section, they will not have any issues with their pelvic floor because there wasn't anything passing through it. Oh, it's honeymoon ready.
Yeah, about that. So the funny thing is we were all pregnant for 9 months anyway. So there's impact on the pelvic floor, no matter whether you had a vaginal delivery or not. And there's a good number of people that have cesarean delivery that did get a decent, way into having a vaginal delivery. And I was one of those, and I will be sure to note here that it's much harder to do that than to do, you basically did two deliveries on that. But people that think that a cesarean is easy, it is not. I
had two of them. So.
Yeah, so you get it. But you can have pelvic floor problems continence issues, those sorts of things, even if you didn't have a vaginal delivery.
Even if it is like a scheduled cesarean.
Yep.
So the problem
Absolutely.
necessarily is not the pressure that is being put on the pelvic floor during delivery, but also like the buildup of the pressure throughout.
Yeah, it honestly depends on the person and what that particular pregnancy and that biology looks like for that person. So it's totally possible that you go straight to an elective C-section, you still carried a baby for 9 months and to still have pelvic floor issues.
Okay.
Yep.
You know, on that same note, diastasis recti, it's going to be affected the same way.
Same thing. Yeah, same thing. And that's, again, that goes back to, and I hope, you know, we can have this conversation 5 years from now and we'll be able to say, you know, we can predict ahead of time who might be more at risk for this. I hope that we can have that conversation. But the data just isn't there yet. And anecdotally, I've seen so many people with great intentions do as much as they can to prevent things, and then become very depressed on the other side because they thought they did everything to prevent it. And still had some issues. So there's a possibility that we can't control everything. And that's more to set moms up not to have the guilt postpartum and not to get down on themselves, but there are options, you know, for help, whether it's, you know, online training programs or, you know, physiotherapist or whatever that is. But please do not blame yourself if you tried to do everything you could to do it right.
Yeah, no, I totally get that. And I see why you're saying that, because I see that quite often as well.
Yeah.
You know, my last question, I promise to go.
Sure.
This is something we actually discussed during Anthony's seminar. I would like to bring it back again. You clearly have a very open mind when it comes to exercise, and to see exercise not as a physical healing tool, but as well as a mental healing tool.
Yeah,
which is
absolutely.
Where I stand in my business, I look at exercise as a mental healing tool.
Yes. Yeah.
But I still see a lot of physical therapists on the old school mindset of the limiting solutions. Running makes you worse. So let's stop doing running. You can only walk because you have diastasis recti, and any type of exercise that you do is going to worsen it. So I am not a physical therapist myself, so it is very difficult for me.
Yep.
It's just like it would be a little bit outside of my scope of work, because I ask my girls to go to a physical therapist to ask for approval. And I'm used to being surrounded by people who are open-minded, like yourself, like me. And so,
how do you vet? Is that what you're asking?
What do I do when I'm dealing with there is already a very limited amount of physical therapists that is specialized in this area, and then whenever I send a client there, they're told that they can't do anything.
Right. Well, and I'll be honest, I have that problem as well. And a lot of my practice focuses on women who have seen other practitioners, didn't get the care that they were looking for, and then come find me. So, you know, first of all, to find a physical therapist, if you're in the States, the Women's Health Association, Women's Health APTA.org, you can find a physical therapist there. But it's all about vetting. And, you know, just as you've hopefully were able to vet your OBGYN, or you vet your trainer or whatnot, you want someone that resonates with you. And it's perfectly fine to ask the questions, you know, how would you typically treat somebody with this? I like to run. Do you see, you know, how often do you have women that return to running? Or is that something, you know, it's perfectly fine to ask those questions and vet your healthcare professional. And I think, especially now, we are so much more knowledgeable about the options that are out there because of the internet, because of social media. And I mean, if I were not in this field, and again, I'm a really active person, I want someone who
is going to support.
It's going to support me and work with me. And for example, I love working with the trainers that my patients work with, or the coaches, or those sorts of things. If you find somebody that has that collaborative relationship, that's where you're going to get your best gains. So if it, you know, for example, right now I have women that follow people's training programs online. But the person online realizes, the trainer realizes that that person needs extra help. They know that I am friendly to that type of activity. And it's finding your community, and that's going to be your support community, but also a medical community that understands where you're coming from. And it's perfectly fine to ask for that.
Yeah.
Making sure that, they're vetted and, they know what they're talking about. But we're out there. There's more of us, and hopefully we'll continue to grow. But I run into the same thing that you run into, and it's frustrating. Because it just doesn't have to be that way.
Especially like for me, because I am not a physical therapist. So yeah, we almost run into the thing that is like, oh, you're just a trainer. Yeah, I'm just a trainer who has been trying to educate. I've been trying to educate myself.
Yeah, I'll be honest with you. Like, I look at, other people that my clients work with as part of the team. If I have somebody that, I don't want anybody talking down to me, But at the same time, if I'm working with a trainer, they know how to train, they know how to scale, they know how to coach, they need to do that. They know their lane, I know my lane. Let's make sure that that works together. So find those relationships that work. But I think it's perfectly fine to say to them, hey, actually, you know what? There is some good literature that says that this is, we're trending in this direction now. Would you like to talk more about that? And I'm all about growth. And so the more we can have opportunities, and I think that's how we got to talk. I said to him, like, you have the megaphone, and the more we can work together, the more that we can talk about options and give women choices about what to do. We are all better if we work together. So if you find those relationships that are in friction with each other, you know what, you may just want to go a different direction. But
and I agree with you, and I think that it is a very, very good point. I just can't help, again, because I lived in Europe.
I know it's hard. It's hard.
Like it's very hard for me to get over the fact, like, the amount of professionals is already limited, so it's not even that you have much of a pool of options.
Well, what's amazing now is, now that we are connected, I'm happy. I'm on Instagram, I'm on Twitter at Carrie Pagliano. If anybody wants to message me and say, hey, do you know anybody in my area? There's a lot of resources that are out there to help find you help. And if I don't know somebody, I might know somebody who does. So the more we can kind of connect to each other, the better.
And now that we're here, tell everybody where they can find you.
Sure. So
what do you do? Where is your clinic?
So my practice. Exactly. So my practice is in Arlington, Virginia. So just outside of DC. It's Carrie Pagliano Physical Therapy. And I'm on Instagram and Twitter at Carrie Pagliano, and on Facebook for Carrie Pagliano Physical Therapy. So try and be pretty easy. So CarriePagliano. With your hands, it's more fun.
I'll add the caption whenever.
But if you're interested in talking more about options near you as far as PT goes, or if you're a trainer and you're watching this and you want to know about contacts near you, even if you're not a client, I'm happy to talk to whoever. I love connecting people. I love that we've been able to have this conversation, and I appreciate that you've been so open to kind of learning more and helping people with your voice.
And it's been very eye-opening, especially since going to the seminar with Anthony and meeting you and being around people who are a lot more open-minded when it comes to training, because it has opened my mind as well. Like I have a pregnant lady right now, and she's like, I love running. I miss running so much. If you were, I would say 5 months ago, I would probably have told her, no, you're not running. But now I'm like, okay, you run and see how he feels, because I know she has the body awareness for that. So it's amazing. It's been very, very eye-opening.
Yeah, well, good on you, because there's nothing better than to give somebody permission to feel comfortable in their body again and kind of find themselves again, especially, with all the newness that comes with being a mom and pregnancy and whatnot. So
and that's I think what is important. And I think there is too much expectations out there on how a mom should look, but they forget to talk about how a mom should feel, and how it's okay for you to feel like you want to take some time for yourself, that you want to improve yourself, that you want to feel good. That's not selfish. It is just being human.
Yep. My kids are happier when I'm happier.
Yeah, no, I totally agree. And it's been a bit of an uphill battle, even like for myself as well, because I come across, oh, but it's selfish. No, it's not selfish. Wanting to be better for myself, and then I'll be better for everybody else around me. Like if I get to the gym, it just means that I'm not going to be a bitch. So
Exactly.
I'll be better for everybody if I'm not a bitch.
It's better for everyone, really.
For the safety of everybody around me, let me go to the gym.
Exactly. Yeah.
Carrie, thank you so much.
Oh, thank you, Ty. This has been great.
I really appreciate it. And then I'll send you the link whenever I get finished with everything.
Awesome. Sounds
Thank
good.
you.
All right. Take care.
Bye-bye.
Bye.